number of faces here today and a number of individuals that have come historically and some new ones, so thank you for coming. We have scrolling across the screen some announcements of upcoming events. If you're not familiar with our programs and learning abroad opportunities, read on, be excited. We have some fantastic opportunities coming up. I'd like to actually take today, and we have a very special group of visitors. One of the fortunate opportunities that we've had over the past few years is, even though we are in public health a graduate program, we've been fortunate in having very well-trained undergraduates come on our programs that have enhanced the learning and the capability of our programs. And part of that is the many hands make light work, and so it's truly been fortunate that we've had so many willing and capable volunteers. So we've had a group of them as part of their coursework put together a series of presentations, and they're going to present today what they have done in global health over the past year. And I'm actually very excited to hear this. We have had so many rave reviews from so many different groups in the university that it is truly a pleasure. So welcome to the Honors College Global Scholars, and we look forward to hearing from you, and they will be introducing themselves as they go along.
Thank you. Good evening, everyone. My name is HARJIT KAUR, and we are a part of the Global Health Scholars at the University of Utah, which is a part of the Honors College. We're here to present the Youngster Revolution, Finding Refuge in Global Health. As I've already said, my name is HARJIT KAUR, and I am a biomedical engineering student. It's my senior year, and I have been a part of Global Health Scholars for 3 years now. So I'm pretty sure you guys have heard of some great revolutions in history. So we have the scientific revolution, which is great unless you're a part of the Flat Earth Society. Then there's the American Revolution, which is again very great unless you are British. And finally, the Industrial Revolution, which is great, but please ignore the inversion. One thing in common with all these revolutions are there's winners and losers. However, in global health, there's a revolution in all of us. As the Global Health Council states, in global health there is no us versus them, there is just an us, and we are all winners. I would like to now share the outline of our presentation. We are going to discuss who the institutionalized revolutionaries are, how they embrace the world at home, how they walk the talk, and finally the spark that started the revolution. I will now hand the time over to KAJSA.
Can you guys hear me? We're good? My name is KAJSA VLASIC. I'm a senior in English here at the University of Utah, and this is my 4th year in Global Health Scholars. So before we start getting into the nitty-gritty of who we are and what we do, we want to go ahead and kind of just get through some definitions of some terms we'll be using during our presentation tonight. And the first is that we see global health as something that encompasses well-being and health for everyone throughout the world, crossing and transcending binaries and boundaries that are present in the current world today. The second kind of goes back to our title, and we're going to talk a lot about the youngsters. And we see the youngsters as ourselves. Everyone in Global Health Scholars in the Honors College was part of the millennial generation. We were all born between 1980 and 2000, and we believe this is a really interesting factor and facet of who we are in the world today. So as an English major, I like to think through ideas and concepts in terms of character development. So if I were to tell you, well, what do you think your ideal millennial character would have as a series of traits, I'm pretty sure you would come up with a list of things that kind of hint at someone who probably sits at the dinner table texting, not participating in real social interaction, and kind of is more into the technological world than anything else. But we believe a lot of these factors really are a good part of why we want to be and can be a great aspect of the global health world. And I think one thing that everyone should recognize tonight is that we were all born in a world with complete access to technology and information. We have been born in a world where we can click and search for things all over the world, and that really connects us not just to people here in Salt Lake and Utah and the rest of the United States, but also throughout the world through social networking platforms and just using Google and our laptops. So what is this revolution that we're talking about tonight? Well, we recognize that historically global health has been approached through conquest, colonization, and charity approaches. But our revolution that we think we have in global health is approaching it through collaboration, and we believe that is a very millennial thing of us to do. So I'm going to hand the time over to Scott, who's going to go into a little bit more depth about what we've been doing. Thanks.
Okay.
There you go.
Cool. All right. Hello, everyone. My name is Scott KHUU. I'm a sophomore in chemistry, and this is my first year participating in the Global Health Scholars Program. So I want to talk about how we are institutionalized revolutionaries. So as Global Health Scholars, we're trying to develop an honorable band of revolutionaries. And we're institutionalized because we are part of the Honors College at the University of Utah. And we are one of the many scholars groups that the Honors College has to offer. The way we are revolutionaries is that we're trying to change the world through scholarship. And we are embracing scholarship through the U style. The University of Utah has 3 key elements of scholarship. 1, the discovery, creation, and application of knowledge. 2, the dissemination of knowledge. And 3, community engagement. From the U's mission statement comes our own vision. We provide an environment for the development of leaders with an enhanced global health perspective who inspire change in the world through scholarship. And the way we're implementing our vision is through our own mission statement. Through a scholarly approach, diverse perspectives, and collaborative efforts, we engage in academic and practical activities that lead to local and global improvements in the health and well-being. And I'd like to turn my time over to CALLI.
Sorry, thank you. All right, so my name is CALLI Bennett. I am an anthropology major here at the University of Utah as a freshman. This is my first year participating in Global Health Scholars. I am introducing the 4 initiatives of Global Health Scholars. These initiatives further our mission statement by providing opportunities for practical and academic activities that further global health. But before I introduce what these global health initiatives actually are, I'd like to talk about where they came from and how they were really created. So in 2008, the Global Health Scholars Group was founded, and since then it has experienced rapid progress and change, and it's been revolutionized. And one of the key and pivotal moments of this happened at the 2012 Global Health Scholars Retreat, in which they created this initiative philosophy, and also they created the vision statement and the mission statement. At this retreat, they were able to come together and articulate the what they wanted to get out of Global Health Scholars as students. And this is really significant because it wasn't handed down by the faculty. It was created by students, and it established Global Health Scholars as a student-run program, which I think is pretty awesome. The first initiative that I'm going to talk about is the Scholarly Dialogue Initiative, in which we learn about, discuss, and analyze information regarding global health and issues related to that. It's important as scholars to have a working vocabulary and knowledge of global health, and we achieve this through our Scholarly Dialogue Initiative. The second initiative is the Sharing Initiative, and this is related to the Scholarly Dialogue because we take what we've learned through the Scholarly Dialogue and share it with people that may not be as familiar with what public health entails, and we learn how to effectively communicate in that way. The third initiative is the International Engagement Initiative, where we take the initiatives one step further and apply our knowledge and around the globe. And the fourth is the Resettlement Initiative, which related to the International Engagement Initiative, we are applying what we've learned, but it's super awesome because we get to apply it in our own backyard among a select group of the resettling refugee population of Salt Lake City. And
I'm going to turn the time over to Izzy, who's going to discuss these further. Hi, I'm Izzy ALDER. I'm a senior studying Health, Society, and Policy, and I'm a very proud fourth-year member of Global Health Scholars. So CALLI has kind of introduced what our initiatives are, and now I want to walk through them in a little bit more depth and talk about how we actually achieve what we want to through these initiatives. So the Scholarly Dialogue Initiative. This initiative is all about building a foundation of knowledge in global health. The way we've approached this is through readings, research, personal experience, presentations, and critical assessments. The topics covered in the Scholarly Dialogue Initiative vary, and they're largely reflective of student interests. But this year we've been able to cover topics such as approaches to health development and multidisciplinary aspects to global health. The Sharing Initiative is all about communication. To be an effective scholar in the field of global health, you have to be able to talk about what you know. You have to be able to have the skill set to share the knowledge that you have gained about global health. Here at the university, we have had a lot of great opportunities to present this knowledge. Some notable ones include the Utah Global Health Conference and the Honors Scholars Open House. Everyone sitting in the room right now is actually experiencing the Scholarly Dialogue Initiative, so I just want to give a little thank you for your participation. The International Engagement Initiative is really cool because it gives students an opportunity to get out of the classroom, get into the world, and participate in established global health programs. We're able to do this through our partnership with the Office of Global Public Health and the Learning Abroad programs that the University of Utah offers. So this map shows some of the sites that have been visited by current and past global health scholars. I personally have had the opportunity to travel to Kumasi, Ghana this past summer and Chandigarh, India 2 summers ago, and both were incredible experiences that really enhanced my knowledge of global health. I also want to point out that Utah is included in this map because the global health work going on here is very notable, and I think it's fair to put it up among the other programs. So before I talk about our final initiative, I want to take a pause and take a moment to talk about how the initiatives work together. So our initiatives were not designed to be exclusive. By creating the initiatives, we hoped that they would integrate with one another and complement one another, and really all together create an enhanced learning environment. So this diagram kind of illustrates how we go about this, how this actually works. So research, readings, and discussions lead to knowledge and understanding. With this knowledge and understanding, students are able to go out into communities across the world, including their community here, and they're able to translate this knowledge and understanding into action. This action then leads to progress and change. It's important to note that this arrow is double-sided because there's a lot of knowledge and understanding that comes from this action. And as we're participating, we're able to take this knowledge back into the classroom. So for global health scholars, we see great value in embracing the world at home. We understand that there is an importance to thinking globally but acting locally. So with that in mind, we've established our Resettlement Initiative. And the Resettlement Initiative is really an opportunity to take ideals and translate them into action. The purpose of the Resettlement Initiative is to give global health scholars an opportunity to take these global health practices and principles and go apply them in their local Salt Lake City community. Kind of here, it's similar to the diagram I just showed, but we're able to, learn in the classroom and then take this knowledge and go out into the community. Once we're in the community, we can learn a lot that is unable to be learned in the classroom.
and we take this knowledge back into the classroom. So both are very important components. We really can't talk about the Resettlement Initiative without first mentioning Gerald Brown. Gerald Brown is the Executive Director of the Refugee Services Office here in Utah. And in the spring of 2011, Gerald Brown challenged University of Utah students to engage with this resettling refugee population. As global health scholars, we feel that our Resettlement Initiative is an answer to this challenge. We felt it was important, as we're putting together this Resettlement Initiative, to develop a mission statement. We thought that this would be a way to articulate and direct our efforts so that we are, achieving something and working towards something. So our mission statement says, in collaboration with the Refugee Services Office of the Utah Department of Workforce Services, Global Health Scholars is teaming with students with refugee status to improve the resettlement process using a scholarship-based approach. This initiative is built on a strong collaboration. This is a collaboration between the Utah Refugee Services Office, the Global Health Scholars, and the resettling refugee communities. Nothing would be possible if this collaboration was not in existence. And we feel that really key components to this collaboration include communication. Open, honest, transparent communication between partners. We all need to be on the same page to feel comfortable in voicing our thoughts and opinions and ideas, and to be willing to listen to the voice, opinion, and thoughts of others. Constructive feedback. We need to be able to both give and receive, to tell our partners what we think, but also when they have some constructive feedback for what we're doing, to take it and run with it and improve upon it. Shared goals and intent. We all need to be working towards the same thing, or else nothing will be accomplished. So again, that's why we've established our mission statement. That's why we place strong emphasis on this relationship between the collaboration, because we need to all be understanding one another. And finally, multidisciplinary and unique perspectives. These three partners each bring a very unique perspective to the table. And we know that we need to value those unique perspectives. We might have different roles in this partnership and collaboration, but each is very important and each is vital in achieving success. So now I would like to turn the time over to Megan, who will continue. Thank you. All right. So my name's Megan. I am a junior in International Studies, and this is my first year participating in Global Health Scholars. So I'm going to talk to you a little bit about refugees and the refugee population in Salt Lake City. The official definition by WHO is that a refugee is a person who must flee their home country because of some sort of persecution based on religion, race, nationality, or belonging to a particular social group. So in the world, there are 15 million refugees, and this is not including the 27 million internally displaced peoples who are not able to flee their home country and often experience much worse consequences because of that. In the United States, we have 2 million refugees, and in Utah, we have 50,000. And so you can imagine that's about enough people, actually more than enough people, to fill the Rice-Eccles Stadium. So we have a really healthy refugee population here in Utah, and most of those refugees come from Somalia, Sudan, and Bosnia. And so here's some interesting statistics on refugees. 44% of refugees are under the age of 18. So this is something that really hits home for a lot of the global health scholars, because these are people that we see as our peers, and people that we can relate to and hopefully work with them to possibly improve their quality of life. And also, less than 1% of people who are refugees are actually resettled through the United Nations High Commissioner for Refugees. So that's an incredibly small percentage of people who are being resettled to different locations around the world. All right, so resettlement.
Some refugees are obviously resettled to Utah, and once they get here, they're out of immediate danger, although they do face a number of challenges in acclimating to a completely different lifestyle and new culture. So some of the challenges, as you can imagine, there would be an enormous amount of culture shock. They're going to feel oftentimes frustrated, disenchanted, and isolated from society because Native peoples may believe that they're different and scary and seclude them in different areas throughout the community. There are enormous language barriers. Oftentimes they're unable to communicate their emotions or even their needs. There are many emotional health struggles, maybe possibly post-traumatic stress disorder, and they're unable to find resources in order to help with these kinds of things. It's difficult to find and keep a job because of the language barriers, or concepts like money management may be foreign, and so it's difficult to attain self-reliance. So going along with this is what the resettlement initiative is that we're working with people who are peers. They are resettled refugees, working with them to figure out exactly what their specific needs are and how we can capitalize on both of our assets in order to hopefully improve the quality of their life. And now I'll pass it on to Fiona.
Sorry. My name is Fiona WEATHERSBY, and I am a freshman in biomedical engineering, and this is my first year in Global Health Scholars. As we've been saying throughout this entire presentation, millennials like to take a slightly different approach to everything. And so in our approach to the Resettling Initiative, we wanted to include sustainability, a long-term vision, building of community and scholar capacity, generalizable knowledge, and engaged scholarship. In our engaged scholarship, we wanted to build a relationship that we could maintain, but also use it as a forum for our application of knowledge and also use it as a learning method to maintain these relationships. And in these relationships, we weren't looking simply to build partnerships, but to also build friendships. And we wanted to maintain these friendships, so we meet monthly in small groups and also in social events. We have open communication, and by doing this, we have set goals that we both want to achieve. And to ensure our equitability, we look to see our partners as our peers, as our friends, because everybody can provide expertise in this field. Our long-term objectives include a continuation of this interaction so that we can continue to build these friendships and partnerships so that we may continue to integrate within communities and thus better all aspects of health. I would now like to hand the time over to Michael.
Hi, I'm Michael Gua. I'm currently a freshman majoring in biomedical engineering. And like Fiona, this is my first year with Global Health Scholars. And I'm going to be talking to you about walking the talk. So for 2013 and 2014, Global Health Scholars decided to focus on partnering with resettling youth in Utah, who are primarily high school age, so they're our peers. We're all millennials after all. And we wanted to put an emphasis on making connections with these kids. So we planned a lot of social events, and we also wanted to make sure that we're partners. So we also wanted to focus on shared learning and collaborative problem solving. We've encountered a few challenges with implementing the resettlement initiative, and these come in the forms of communicating with our partners. And related to that is linking with RSO. They're our primary liaison with these kids, and they've recently had a turnover, so we've had a few problems communicating. We've also had problems with transportation, maintaining interest, and even finding time to meet. Despite our challenges, we've also had a lot of success. We had a lot of initial interest from both groups. We've had a lot of success with academic mentoring, which is stuff like helping these kids out with their homework and even helping them apply to college. We've also had a lot of success with making friendships. Some of the girls even said they took time out of their schedules to have girl time. And because we've had so much success with becoming friends and getting to know each other better, we've also had a lot of success discovering solutions, not individually, but as partners. Now I'd like to turn the time over to SIMRAN.
Hi everyone, my name is SIMRAN. I am a junior in chemistry. This is my 3rd year in Global Health Scholars. So all revolutions start with a spark, and our spark was 40 millennials. So we had 14 resettling refugee students and 26 Global Health Scholars. And we realized that this is a very small sliver of the world population. We are Global Health Scholars after all, but we do have a big vision in mind, and we think that those 40 students is the first step to achieving our vision. As millennials, we believe that we're particularly suited to collaborate, develop, and implement approaches where everyone can be healthy and well. And the best part is that we can start in Salt Lake City. We don't have to fly overseas to engage in global health. So as Global Health Scholars, our mission is to change the world through scholarship. So I'd like to invite all of my presenters and faculty advisor for a Q&A session. Thanks.
Okay, we'll open it up to questions for the group. Okay, Dr. Vanderslice.
So, getting impressed about the way you guys put together the presentation, where do you see it going? What's the next step? I mean, I get the sense that you feel like you made good headway, but you're just ready for that next thing.
Okay, so as we kind of mentioned early on in the presentation, fall 2012 was the first year that we decided we wanted to be a student-led and student-driven organization. So this year was about that first step of implementing a vision. It's the first time that we've actually had student leaders, and we've developed a curriculum, students have developed a curriculum for themselves. We've started the resettlement initiative, which has been the focus of the presentation. Where we're going in the future, I think, is now that we don't have to worry about, the nitty-gritty, how do we run an organization, we can actually focus on, building our relationships with our partners. We can work on further articulating our long-term goals. We can, learn from the challenges that Michael talked about this past year and make the challenge list smaller and the success list larger. So I think our long-term objectives are to keep moving forward, to gain momentum, to grow stronger, and to just get better. Does anyone else have anything?
I think also a big focus this year was creating relationships that were built upon trust, because a lot of these resettling refugee students have experienced so much coming to Salt Lake City and just getting here. So I think a lot of us really just focused on creating those relationships where we have, where we're working with students and they feel like there's enough trust in the relationship to ask questions and feel comfortable having those conversations with us. So I think another aspect of that is recognizing that this year really was a foundation year in that respect. And hopefully next year and throughout the rest of this year we can continue having those conversations and maybe have slightly more difficult conversations about what are challenges for you, what do you think we can help you with, and what can we gain from you in respect to that as well. So I think that is one big aspect of moving forward and part of the collaborative process.
I think another thing that we would like to address with this is that we are student-led and that we are trying to make a difference in the world. And I think we'd like to motivate other people to realize that you can make a difference in your own backyard, that you don't have to travel the world to make a difference in global health. So I think that's another part of our vision, is to motivate others.
Simran, can you talk about the transition from past years to this year in terms of the scholarly dialogue initiative which you lead?
Yeah, so I'm one of the leaders on our leadership team, and I'm in charge of scholarly dialogue, so I get to assign readings and stuff, which is really fun. I think it's fun. It's my favorite part. But so in the past, we focused a lot on reading books, so we'd assign books, and we didn't really know how to digest them. We'd try small groups, but we really couldn't get into the meat of what the work was talking about. So now in scholarly dialogue, I mean, focusing on, things like research articles, like, looking in journals. The New England Journal of Medicine, I think, just got a global health section, so, pulling from those resources has been much better than assigning books. So we send out readings, like short readings, not too long. We talk about current events. We do all sorts of fun stuff. I think it's fun. But so it's been a good transition, and we've learned a lot that people don't like to read big books. So.
Very a big problem in public health and medicine and other aspects of the world is we get stuck in silos in our own professions and our own fields. And I'm impressed with the breadth of expertise, the different fields that you're in. What's something you've learned from this experience working with so many different people, and how can it help global health?
I'll start because I have this. It's really awesome. I'm in my third year, and I'm always impressed at the different majors that come to Global Health Scholars. And it's really cool because I think we all have something to contribute. So as a chemistry major, I'm born from the sciences. And I have a lot to learn from KAJSA, who's an English major, or from CALLI, who's an anthropology major. And I feel like global health is a perfect place to break down those silos that you talk about. And I think it's a really awesome place to meet people. I don't want to just be friends with chemistry people.
I think other than also the academic side of our different majors and learning from each other, one great thing is that we're all different. We all have our own unique narratives. We all have our own voice. And the amazing thing about that is I love learning about seeing other people's perspectives to an issue or a challenge or a success, and really understanding how we all can think differently, but when we come together, we can think of innovative and diverse ideas. And I feel like that's one great thing even about our leadership team, because there is not just one leader, but we have a group of students that have come together and developed these initiatives. And hopefully in the future, having the new crop come in and new students and their ideas and perspectives can really allow us to grow as a group, as a student organization. And then finally, because we are the millennials, I think it's a great thing that we're always open to building relationships with one another and learning from one another.
Okay, kind of going along with that, I think everyone who presented here tonight, we all kind of seem like we're on the same page and, thinking the same way, but the reality is when we get into Global Health Scholars, we often disagree and we often call each other out on things, and people have different opinions and different perspectives, and question opinions, and that's very much like the real world. So I think a great opportunity in Global Health Scholars is there is a diversity present that prepares you for the diversity that exists in real life, and it prepares you for your future career, or it prepares you to get out and work with different communities. That's always going to be a challenge or opportunity, however you see it in global health, that people think differently. And what a great way to start learning how to make it an opportunity and not keep it as a barrier and obstacle to success.
For all the scholars who were here, this was a collective effort, but for those that didn't present, I have all the scholars in the audience stand up as well to acknowledge for their work. This was a tremendous amount of work by this collective group to put the presentation together, and I just wanted to make sure all were acknowledged in that. Dr. Benson?
So for those of you nearing the end of your time in Global Scholars, what are you most proud of? What has given you the greatest satisfaction? And for those coming up, what are you most really looking forward to?
Let's start at one end. Just have you say whether you're nearing completion or just beginning, and respond to that question.
Okay, I'm a third year. I feel like I'm just beginning, but I guess I'm near ending. And I think the best part of Global Health Scholars for me was we talk a lot about fall 2012 and the transition from really a faculty-led organization to a student-led organization, and being a part of, so I was in the year where that transition happened, where it was faculty-led, turned to student-led, so seeing that and being part of that was the best part for me.
So this is my first year starting, and what I'm most looking forward to is the opportunity to learn and grow. That was actually in my essay that I submitted when I applied to join the group. I think it's an, maybe someone read it. But I think it's a great opportunity to learn more about the field of global health and to learn more about ourselves and how we can contribute to the fight to make health better for everybody in the world.
I am a first-year student in global health, and I think the thing I'm most excited for is popping bubbles. And that sounds really silly, I know, but something that I learned this year is there's no such thing as a personal bubble or a comfort zone, ever. You don't have it. And especially when you're learning about global health, in our scholarly dialogue, SIMRAN would choose these awesome readings that would challenge us to look at what we had in our lives and realize that maybe we were privileged or maybe we just didn't understand something. And so I really enjoyed that. And it was really cool to learn and grow in that way. So that's what I'm excited for.
So this is my first year, but I am actually graduating next year, and I'll be participating in a study abroad, so I'm unsure if I'll be able to continue on with Global Health Scholars, but I've really, really enjoyed this year, and I'm super excited for the resettlement initiative to expand. I think what we did this year was really great, and we did face a lot of challenges, but we also learned how to deal with those challenges. And I think it's awesome that we are building partnerships with these students in our community and opening doors for both of us and learning what we both have to offer each other. And I think that's really important in specifically global health, but also in everything that you do, to be open to different perspectives and learning from others. So I'm really excited for that.
Okay, I am in my final semester of my undergraduate career, and I have been able to participate in Global Health Scholars for 4 years. And looking back at my first year in Global Health Scholars, I remember we were invited to participate in a regional honors conference, and part of that opportunity included a panel discussion. And I remember just being mortified by the thought of sitting in front of people and talking on the fly, on the spot, about global health. Comparing that to now, I just see that I've grown a lot in Global Health Scholars and have gained leadership skills, confidence, knowledge in the field, and I feel very well prepared for a full future in the field of global health.
All right, so this is my first year in global health as well, and I am most excited for the future to see where Global Health Scholars as a group goes, like what it can accomplish in the future with especially the resettlement initiative. And I think it's an awesome partnership, and I'm so excited to see where it leads and so excited to participate and learn about what global health is and how I can change how I can change it and how I can be a part of it. And
Hey, this is my first year in global health, and I'm looking forward to improving what we've done this year. As we said earlier, we had some challenges, but learning from your challenges and the mistakes you've made will overall help the project. And I remember applying to this program last year with the desire to learn more about global health, because being a chemistry major, we were pretty much just stuck in our 340 student lecture hall classes absorbing information. In this scholar group, we're actually able to communicate, discuss, and actually go out in the community and implement our ideas.
So I'm in my 4th year, but I'm adding a 5th year to do a victory lap, so I'll be here next year. So I think I'm most proud of just growing within global health. I was born in the developing world, and my parents, when we moved to the United States, really made an effort to have my sister and I recognize that we did have a privilege. You know, but we also had the ability to learn and engage in scholarly initiatives to impact the world around us and help people who maybe weren't born with that privilege. And Izzy and I have had the opportunity to lead the Resettlement Initiative since the spring of 2012, and seeing it grow and being part of an active scholarly-based initiative within my own community with individuals I really wasn't interacting with, and now forming friendships and learning how to interact with the Refugee Services Office. So at a state level, how to work with an organization that exists, especially as a student without much seniority. A lot of those experiences have really helped me grow as a person, and I'm really looking forward to moving on. I'm an English major, but I'm applying to medical school, so again, this kind of goes back to that interdisciplinary aspect. I'm really excited to engage more with people with different ideas, but I'm really proud of everything we've done, and I'm excited to pass it on next year.
So I'm in my 3rd year in Global Health Scholars, and I'm actually graduating this year, so it's my final year. I actually started Global Health Scholars. I went on a global health trip to India, and when I was there, I was shocked that, you know, I finally could find the vocabulary for the dreams I've had since I was very young. And I was sad that I wouldn't be a part of anything like that again. But then IZZI, who was also part of the trip, told me about Global Health Scholars, and I was like, oh my gosh, this is like the greatest opportunity because I can be a part of global health for the rest of my life. And what I am the most proud of is I've become a scholar, and I think that's an opportunity that I never maybe thought that I could achieve because I haven't seen it in my family. But like becoming a scholar really entails us, like allows me to learn and then share and also grow as a leader. And I think that's the great thing about Global Health Scholars.
I thought your presentation was put together really well, and it seems like the Global Health Scholars program has been pretty successful. I'm just curious, it seems like you have a really cohesive group here, but what are you doing to recruit future students into this program, and you know, what sort of initiatives do you have, and how are you working with your faculty members to recruit more people?
I can start out. So we're part of the Honors College, and the Honors College itself advertises the different scholars groups. But one of our initiatives is the Sharing Initiative, and we hope through that we could get interest from students that are interested in global health. Do you want to?
So how I got involved with Global Health Scholars, I had a friend, obviously, who was involved, and I think that's how a lot of people here got to know about Global Health Scholars. So one thing that I would say most of us do is we like to brag about Global Health Scholars. And so by doing that, we're getting more people interested. And so I think it's mostly through personal interaction, which again, in my opinion, is more meaningful than anything, to be able to have someone who can that you trust and know who can tell you about this group that they are so proud of and are so fond of. And that's, again, how I got involved, and I think how a lot of us got involved as well.
Can I put you on the spot and ask you to say a little bit about the Public Health Community Engaged Scholars?
Oh, sure. So we're just starting the Community Engaged Global Scholars for the graduate program. And we have been looking at what you guys have done and some of your successes and for modeling. And part of ours is modeled offering what you guys have done. So you guys have done an awesome job. So we just feel like, you guys have created a great model for us, and there's not really a need to completely reinvent the wheel.
I wanted to take it sort of the last word and acknowledge all of the scholars because this is an extracurricular program, and these are very busy students. And I just want to applaud you on your commitment to being scholars and
For your dedication to engaging in scholarship in global health, and I anticipate you'll do great things. So thank you so much, and thank you for your participation tonight.
All right, Dr. Alder, Global Health Scholars, thank you. Thank you for an excellent presentation. And just as we're wrapping it up, a save the date announcement out there. There is a Student Global Health Conference on April 26th here at the university. So if you're interested in presenting, attending, keep your eyes open for announcements to come, but save the date, April 26th here at the University of Utah. Thank you again.